So let's start today's Doctors Roundtable by focusing on long COVID. And my first question to you, Dr. Murali Datta, because you look at respiratory department, therefore you know you've come across patients who've gone through the entire COVID cycle. How common is long COVID or post-COVID syndrome? What, according to you, are the clear symptoms? Because in the UK at the moment, 10 to 13% of patients who are recovering from COVID apparently also have long COVID syndrome.
Yeah, Rajdeep, absolutely right. The acute COVID phase has certainly gone beyond, but we are suffering from a huge burden of post-COVID or long COVID. Now, the important thing to bear in mind, long COVID is typically described by the CDC as anything that goes beyond 4 weeks and off COVID symptoms, which is either a prolongation of the symptoms that you had during COVID or symptoms which have abated and then returned, or symptoms that you never had and then they've come back much later. However, apart from this, we have a whole constellation of symptoms that patients are coming with. For example, stiff lungs, which then develop an air leak and go on to develop pneumothorax. We're getting a lot of secondary infections, urinary tract infections, septicemia. We've already gone through the hazards of black fungus, and then of course clots, which can happen in the legs, in the lungs. So apart from just the general fatigue and breathlessness and palpitations and brain fog, which is just a prolongation of what you face during COVID, and that can go on anything up till 3 months. We're also seeing a lot of these fairly serious problems that are preventing the patients from recovering, as per their normal, as what we would have expected, or recovering and coming back.
So are you saying that the fatigue and the breathlessness is now typical among long COVID issues? Are you getting, let's say, out of every 10 patients that you're looking at who've recovered from COVID, how many on an average, according to you, Dr. Datta, would be getting fatigue and breathlessness?
3 to 4. And I think, I don't think one can put a number to it, but I think they've estimated anything from 2% to 20% of cohorts can have long COVID syndromes. Now, obviously, there are many who have recovered sitting at home, and many with mild disease are now reporting that, we're just not feeling, good. They're developing breathlessness, fatigue, and essentially symptoms that are preventing them from resuming normal life, normal routine.
So, because, I have a friend who's recovered about 3 weeks ago and is still in bed, gets fatigue in the afternoon. Should he be actually very worried, or will this pass in a couple of weeks?
So maximum, I think, 3 months. It may spill over beyond that. But again, what is important to remember is, a lot of mood things as well. I know we have a panelist who will go into that. But, low mood is a very common association. And this is the point where medications probably have very less role and is much more of dealing with, exercise, diet, mind, and things like that, rather than relying on a whole lot of medications. For the typical long COVID patients who do not have other organic pathologies.
You're saying it's to do with the mind. Let me for a moment bring in from Lilavati Hospital in Mumbai, Dr. Varka Chulani. You can explain to us, Dr. Chulani, how can COVID patients fight negative thoughts? There are those who are actually asking me, how do you deal with pessimistic thoughts of death? Because that is adding, in a sense, I'm breathless after recovering, and I'm getting thoughts of, mortality almost.
Yeah. So, Rajdeep, more often than not, patients are more scared than sick. I'm not taking anything away from the actual disease that COVID, gets the person to suffer from. But a lot of all this breathlessness is also augmented by anxiety. So the constant barrage of social media about how COVID
we're trying.
is.
Let me try and get back that line to you, because we are having a small problem with the audio, but we'll try and get back to you in a moment. Let's take more questions that are coming in. And this is a question that perhaps Dr. Prateek Samdani, you want to take, because one fear is long COVID leading also to heart attacks. There's the breathlessness, fatigue, but there's also the fear of leading to heart attacks. Some patients we've seen examples who've gone cycling and done vigorous exercise straight after recovering from COVID, and in 1 or 2 cases there have been heart attacks. Is this a fear?
So vascular complications, Rajdeep, as we call them, is very, very common. See, COVID is not only a viral infection that causes lung issues, it can affect almost every other organ. So your long haul COVID can actually affect the gut, the mind, and the heart besides the lungs. And this is not uncommon. People can get a heart problem, one, because of the nature of the disease. It's a prothrombotic disease. This infection or this viral infection causes the blood to cause clots. That's why you can get a heart attack. Two, many of these elderly people have underlying heart diseases, which has never been diagnosed or has been diagnosed, and yet thus are at a higher risk of getting it. Three, they are not on complete medication. See, many of them who come to hospital actually forget or don't take their older medications, and that can worsen your symptoms. Four, when you recover, you start going into your barrage of exercises immediately. This has to be done in a stepwise graded pattern. You've been sick probably for 2 weeks and more, and if you're a long haul COVID, at least for 4 to 8 weeks, you need to slowly go up. You can have cardiac issues, your pulse can go high, your muscles of the heart can become less, so you're likely to get a heart problem. So yes, it's not uncommon to see blood clots post-COVID.
So are you saying that even in that recovery phase after COVID, don't go to the treadmill, don't do vigorous exercise for a couple of weeks to a month?
Rajdeep, I would say just go very graded. So for the first 2 weeks after your recovery, just do static exercises, walking, not even jogging, then upgrade yourself to a little bit of jogging. And if you're used to more vigorous exercises, at least wait for 4 weeks after you've completely recovered when you start going outside to jog or treadmill or whatever.
Let me understand this also, Dr. Samdani, because these are questions being put. Is brain fog a common long COVID condition or rare? Does long COVID affect organs like kidney and liver? Is long COVID associated with loss of smell and taste? These are 3 potential sort of symptoms possibly of long COVID. Are you seeing a lot of such cases at all?
So brain fogging is pretty much common. So what is brain fogging? Typically, what does the patient come and tell us? Doc, I can't remember. You know, the family member or the wife or the husband will come and say, you know, they typically use the word, Doc, he or she is spaced out. That means they just have a shorter span of attention, and it's pretty common. In fact, only about 13% to 18% after 1 month of recovery actually say they have no symptoms post-COVID. 60 to 80% of the patients will tell you, I have some form of complaint, whether it's fatigue or brain fogging. The other thing you asked me about the other organs, as I said, almost every organ is involved. Liver. For example, the liver can be directly affected because of the virus. So you can get elevation of your liver enzymes. You can get a mild increase in jaundice, but that's not very prominent. And in time, it fades away. Also, therapy that we use to treat COVID for the moderate to severe COVID cases can cause a little bit of liver enzyme to elevate. The kidneys can get affected, 1, because of prolonged hypertension or blood pressure. 2, because it's a vascular disease, your kidneys can actually get damaged because of lack of blood supply. 3, very commonly in the ICUs, when the patients are really, really sick, they get infections, and you can get ascending infection that can actually damage your kidneys. So getting affection of your kidney, lungs, liver, and the gut is